This is Dr. Harry Anderson. I often get a question about older horses, geriatric horses. Now, when I think of an older horse, I think of a horse that's 20, 25 years of age or older. We have so many horses living today that are in their 30s that are staying alive because they improved nutrition over the years has really helped them a lot. But what do we need to consider when they get to that age group? Well, the first thing we need to think about is digestibility of whatever they're eating. Because as a horse increases in age, the wear and tear on that digestive tract, just a normal wear and tear, starts to reduce the amount of absorption capacity, reduces their ability to absorb the micronutrients and things. So we have to have a little more nutrient-dense package for that older horse, just like we do the younger horse. And that's where you have to think about the kind of forage and what you're feeding, what you're putting into that older horse. That has to be highly digestible first. Then it has to contain all of the micronutrients that they need, just like other horses. But the digestibility is the key thing. Now, what happens when they get older and all of a sudden their teeth start to wear out? Well, one thing is, early in life, you need to start floating their teeth, have their teeth checked periodically so that they don't wear out so soon, but they're going to wear out. I have a lot of horses on my program that are well up into their 30s that can't eat hay anymore. They try, but all they do is ball it up and spit it out. When they start spitting out balls of hay, you know it's time to change the program and put them on a concentrated program. Many of these horses now at this age are living on a concentrated program where it all comes out of the feed bag, if you will. Or if you have alfalfa pellets, they are a very good source of nutrients for these older horses, and they're easier for them to eat if they have a little problem. But you need to look at a senior feed, if you will, or a feed that's designed to take care of the senior's needs, and there are products on the market that you can feed to all age groups, and they will do just fine. And it's because they're extremely digestible, and they're easy to eat. Even some of the products, pellet products and things you have to be careful with, because when horses lose most of their teeth, they may have a hard time processing those pellets. So you have to find something that's either a soft texture or put water on to dissolve it, or get something that when they touch it, it breaks into a powder, which extruded feeds are very good for older horses, because when an extruded feed, if done properly, a horse takes it in, the minute they touch that with their teeth or put any pressure on, it turns to powder. It doesn't ball up, and it does not cause any discomfort when they eat it, so they can masticate it and ingest it much easier. Also, an extruded feed is much more digestible than a pelleted feed, and so they are probably the ones of choice for your older geriatric type horses that need that higher digestibility. And then make sure they have a full complement of B vitamins and minerals and good quality protein, so that we increase the fermentation again in that hindgut.